ready for a deep dive. Today, it's forensic pathology.
Ooh, interesting.
But not the stuff you see on TV. We're not focusing on, like, the crime scenes or anything. This is about how it protects vulnerable people, even in, like, regular medicine.
Yeah, that's the side people don't always think about.
Exactly. And we've got all sorts of stuff to go through, academic papers, reports, even what med students are saying. It's all about figuring out how doctors can use this forensic knowledge to help patients of all ages who might, be at risk.
It's a big topic. And it makes you really think about who's vulnerable and how we can protect them better.
For sure. So let's start with the basics. Can you give us a quick overview of how forensic pathology even works here in the UK?
It's actually pretty complicated. Every nation, England, Wales, Scotland, Northern Ireland, they all have their own setups and ways of doing things.
Oh, wow.
Even though the Royal College of Pathologists, they set the standards for everyone's training.
So it's like a puzzle with different pieces all fitting together.
Yeah, exactly. Like in England and Wales, they have this thing called the Home Office Register. It's only for pathologists who deal with deaths that are, well, suspicious.
Suspicious deaths. Okay, now that sounds interesting. What makes a death suspicious to a forensic pathologist?
Well, the pathologist doesn't decide if there was a crime. That's up to the police. But if the police thinks something's off, that's when a death becomes suspicious. And then the forensic pathologists come in. They're like detectives, using the body to help figure out how the person died and what caused it.
That makes sense. But we're focusing on medical students. How does this all connect to what they're learning?
That's where it gets really interesting. Cardiff University School of Medicine, they made this special course to teach future doctors about the signs of abuse and neglect.
Oh, wow.
And those signs, they can be really subtle, easy to miss without training.
So they're giving these students like a secret weapon to protect patients even before they're real doctors.
Precisely. And here's the thing, even with all their medical training, students can struggle to tell the difference between injuries. Like, was it caused by a blunt object or a sharp one? You'd think that'd be simple for a doctor, but the forensic training really makes a difference.
Wow. I wouldn't have thought of that. It makes you realize how much we assume doctors know.
Right. It also shows how vulnerability isn't always what we expect. Not just like the classic image of a frail old person. It can be anyone. No matter their age, their background, anything.
So how did this course change how students saw vulnerability?
Their feedback was amazing. A lot of them had this aha moment. They realized that they themselves could be vulnerable too. It really opened their eyes to who's at risk and how easily someone can become vulnerable.
I bet. Were there any examples from their experiences that really stood out?
Oh, tons. Some talked about their placements. They'd suddenly be in a situation involving safeguarding and feel totally unprepared. It really showed them why this training matters.
Like going from textbook to real life, where the stakes are suddenly very high.
Exactly. And that's why this kind of training is so crucial, preparing them for how complicated real-world medicine is, where the human element is just as important as the science.
Okay, so this course is clearly shaking things up. But how do they teach this stuff? It seems tough to do in just lectures.
You're right. It's not just lectures. They use case studies to make it real. There are 4 main ones. Archie, a child; Alice, a victim of domestic violence; Karen, who went through elder abuse; and Kyle, a case about restraint. Each one shows a different side of vulnerability and what forensic medicine does to protect patients.
Case-based learning, that's a great way to make it feel real for the students. Anything in those cases that really stuck with you?
Definitely. In Archie's case, they have this illustration, a body map.
Oh, wow.
It shows his injuries, but in a way that isn't too graphic. It really makes you realize how many forms child abuse can take.
Oh.
And the signs aren't always obvious.
I can see how that would be powerful. Anything else?
We also had this police officer come in. He specialized in domestic violence cases. And he gave tips on how to talk calmly in these tough situations, showing the students that communication skills, they can be as important as medical knowledge when you're dealing with someone vulnerable.
That's a great point. So how did students react to this unique course? It must have been an emotional roller coaster for them.
You're spot on. The questionnaires, the focus groups, they showed all kinds of reactions. Some were anxious about dealing with these sensitive topics, totally understandable, while others were so grateful to be given the knowledge, the tools to handle these things.
Makes sense. It's heavy stuff, but it sounds like the course gave them more confidence than anxiety in the end.
Yeah, a lot of them said they felt relieved to be prepared rather than caught off guard when facing these things on the wards. They liked they could talk about these sensitive issues in the classroom first.
So it was a safe space for them. To work through these ethical and emotional challenges.
Exactly. And that's so important in training. But there was also this interesting tension in the feedback. Some students wanted small groups for these talks. They felt more comfortable sharing in a smaller setting. But they also knew how valuable it was to have those expert forensic pathologists leading the sessions because they brought, that unique expertise.
Ah, so trying to find that perfect balance between intimacy and getting the best information.
Yeah. And it actually highlights a bigger problem in medical education in general.
Right.
How do you balance the hard science with the ethical social stuff? It's like there's this unspoken ranking of knowledge where technical skills are always seen as more important than the human side of things.
So focused on the body, they forget about the whole person.
Yeah, exactly. And it brings up important questions. Why does this happen? Is it the curriculum itself, the way it's taught? Or are there even deeper biases at play? Tough questions, no easy answers. But they need to be addressed if we want healthcare to truly focus on well-being in all its forms.
Like shifting from just treating diseases to truly caring for people.
Exactly. It's about seeing the whole picture and realizing that a patient's story is just as important as their symptoms. Understanding their life can be key to providing good, compassionate care.
That's fascinating, and I'd love to dig into that more, but for now, maybe you take a quick break. And when we come back, we can explore how forensic medicine can help doctors be better advocates for their patients, especially those who might be vulnerable.
Yeah, I'm looking forward to that. It's funny how this whole forensic medicine thing, it really changes how you see the field. It's not just about, autopsies and crimes. It's about that human side of medicine, vulnerability, ethics, the whole bit, and how crucial forensic knowledge is for keeping patients safe.
It's true. It's like a bridge between the clinical stuff and the real world, with all the social, ethical issues, even legal stuff.
Exactly. And that bridge is only getting more important, especially now with elder abuse on the rise, domestic violence getting more complex, all these kinds of harm that often fly under the radar.
It's like peeling back layers. There's this whole hidden world of vulnerability just below the surface of everyday life.
Exactly. That's why we got to give future doctors the knowledge, the skills to deal with this.
Uh,
It's not just adding more to their textbooks, it's about changing how they think, seeing patients as people, not just symptoms.
so how do we do that? How do we help them develop that eye for these things, that empathy, and the courage to say something if they think something's wrong?
$1 million question.
Uh,
It's not just memorizing facts or procedures. It's instilling that deep sense of responsibility for their patient's well-being, going beyond just the physical, understanding how social stuff impacts their health, their vulnerability.
like giving them a moral compass, along with their stethoscope.
Exactly. It's helping them get it. That patient situation, poverty, inequality, all that, it creates vulnerability, makes them more likely to be harmed or neglected.
So it's not just being a good doctor, but a good citizen, an advocate for those who can't speak up.
Perfectly put. And that takes a perspective shift. Away from that old way of medicine where the doctor knows everything, it's got to be more collaborative, empowering patients, respecting their choices.
Recognizing that the patient knows their own life best.
Right. And that's where communication is huge EE. Doctors got to be great listeners, pick up on subtle things, ask the right questions, make the patient feel safe enough to be honest.
Like detectives. But instead of a crime scene, it's the patient's stories, their behavior.
Exactly. And those clues, they're not always obvious. It's about being tuned into human behavior, the impact of trauma, recognizing those red flags that could mean abuse or neglect.
Seeing the whole person, not just a chart.
Yes. Understanding that their physical, mental, and social well-being, it's all connected. That's where forensic medicine can really change things.
You mentioned earlier how med students sometimes mix up injuries, blunt force versus sharp force. Are there other blind spots this forensic training addresses?
Oh, tons. One big one is thinking vulnerability is just for certain groups, like old folks or kids. But this training shows anyone can be vulnerable, depending on what they're going through.
No stereotypes. Vulnerability doesn't pick and choose.
Right. Another mistake is focusing only on the physical, the bruise, the broken bone, without looking at the bigger picture. Forensic training teaches them to consider the patient's history, their support system, any power imbalances.
So the story behind the injury, not just the injury itself.
Exactly. It's a different way of thinking. Asking how this happened, sure, but also why. And what else in their life might be contributing.
Connecting the dots, because injuries don't just happen out of the blue.
Right. And that's why teamwork is so important. Doctors got to be willing to work with social workers, police, anyone who can help tackle those root causes of vulnerability. create a safety net for the patients.
A whole network of support. It takes a village, right?
Beautifully put. Recognizing they're part of something bigger, we all have a responsibility to protect those who are most vulnerable.
That's powerful. So how do we turn all this awareness into action? What can doctors do to safeguard their patients?
First, got to know the signs. Not just physical, but behavioral changes, emotional distress, things that don't add up in their story. Doctors have to be sharp, picking up on subtle cues that something's off.
Listening with their eyes, too, not just their ears. Taking it all in.
Precisely. And creating that environment where the patient feels safe to open up. No judgment, empathy, confidentiality.
Building trust so the patient feels empowered to talk about tough stuff.
Right. And if the doctor suspects abuse, they're obligated to report it. Legally and ethically, it can be tough, especially with families or cultural differences, but the patient's safety comes first.
Balancing autonomy with safety, a tough line to walk.
It is. And that's why knowing the rules about safeguarding is so important. Doctors need to know what they have to do, what they can't do, and what resources are out there.
Being prepared to act, not just react.
Exactly. And that comes from good training, staying up to date, and being open to new ways of thinking, new ways of doing things. The more they know about forensic medicine, the better they can protect their patients.
Making it second nature, weaving it into how they practice medicine every day.
Exactly. It's a total shift. We got to move past just treating diseases. It's about the whole person, their well-being, their safety, their choices.
A healthcare system where everyone feels seen, heard, protected.
Couldn't have said it better. Now, before we get to the last part of our deep dive, let's focus in on a specific case to show how complex safeguarding is in the real world. Remember Archie, the boy from that medical school course? His story shows what can happen when we're not careful. Vulnerable people can slip through the cracks.
It's a reminder of how important this all is.
Absolutely. Archie's case, it highlights early detection, teamwork between different fields, and really understanding how abuse and neglect work.
A call to action. Be informed, be compassionate, be proactive.
That's it. And it brings up a big question for everyone listening. How can we, as a society, do better for kids like Archie? Make sure they get the care and support they need. We'll keep exploring that and more in the last part of our deep dive. We've talked a lot about how forensic medicine helps protect vulnerable patients. But let's think about the doctors themselves for a minute.
Oh, that's a good point. We've been focused on the patients, right? But this kind of knowledge, this responsibility, it must have an impact on the doctors, too. It's one thing to learn about it in school, but then actually using it, real-life situations, with so much at stake.
Exactly. And when you look at what those med students said, the ones who went through that training at Cardiff, it's a mixed bag of feelings. Some were anxious about dealing with abuse, neglect, worried about messing up, saying the wrong thing.
I can see why. Those are really tough situations. No one wants to feel unprepared, especially when someone's well-being is on the line.
Right. But it's not all negative. Many students also felt empowered, grateful for the training. They felt like they could actually DO something, protect their patients. It's like they got new tools and more confidence to handle things.
So it's finding that balance, acknowledging how tough it is, but also giving doctors the knowledge and skills to do their job well.
Exactly. And that empowerment, it comes from different places. Understanding the laws, the ethics, knowing how to document things properly, feeling comfortable working with others, like social workers, the police.
Having that clear path and a support system to guide them through those tricky situations.
Exactly. But there's something deeper, too. When doctors really embrace forensic medicine, it changes how they think. It's not just about treating the disease, it's about advocating for the patient's well-being as a whole person.
Becoming a guardian, almost? Protecting their safety, their autonomy? That's powerful stuff.
It is. And that can be really motivating for doctors. It gives their work more meaning, makes them feel like they're truly making a difference, not just fixing symptoms, but really impacting people's lives.
That human connection, going beyond the textbooks, the science, to really see the person in front of them.
You got it. And that connection can be life-changing, not just for the patient, but for the doctor too. It can remind them why they went into medicine in the first place.
Reigniting that passion, remembering what a privilege it is to care for another person.
Exactly. But let's be real. Integrating forensic medicine into everyday practice, it's not always easy. It takes time, resources, and a willingness to change how you do things, which can be tough in such a busy system.
So how do we make it happen? How do we make this integration smoother, more effective? Where do we even start?
It starts with education. We got to make sure med schools teach this stuff well. Comprehensive, engaging training, going beyond the basics, giving them the skills they'll actually use day in and day out.
Making it a core part of their education, not just an extra, something they can choose to learn if they want.
Right, and you can't stop there. Continuing education needs to include forensic medicine, too.
Yeah.
The latest best practices, new trends, it's always changing. Healthcare, so doctors got to keep up.
Like a toolkit they can keep adding to, refining as they learn and grow.
Perfect analogy. But education isn't everything. We also need to create supportive workplaces where doctors feel safe to speak up if they're worried about abuse, neglect, even if it means challenging authority.
A culture of open communication where they're not afraid to say something, knowing they'll be taken seriously.
Exactly. That feeling of safety, support, it's so important. Doctors need to know they're not alone, that there are people, resources they can turn to when things get tough.
A safety net, not just for the patients, but for the doctors, too.
Absolutely. And this needs a mindset shift. Everyone needs to get on board, institutions, society as a whole. We got to recognize how important forensic medicine is, invest in it, create policies that prioritize protecting vulnerable patients. It's about all of us coming together to protect those who need it most.
Recognizing that protecting the vulnerable, it's not just one person's job, it's a shared responsibility.
Couldn't agree more. And it starts with education, awareness, being willing to challenge the way things are done. By talking about forensic medicine, bringing it into the light, we can give doctors the power to be better advocates, create safer healthcare, and ultimately build a society that's more just, more compassionate.
That's a powerful goal to work towards. So as we wrap up our deep dive into this fascinating, complex world of forensic pathology, let's leave our listeners with something to think about.
If we truly believe every patient deserves to feel safe, respected, protected, no matter what, then every doctor needs the knowledge, the skills, the support to make that happen. It's a call to action. We all have a part to play in shaping a healthcare system that puts well-being and justice first.
A reminder that what we've learned today, it can be a starting point for real change.
It's been great exploring this with you. And remember, even small actions can make a difference. Keep learning, stay informed, and keep talking about these issues that are shaping the future of healthcare.
Thank you for joining us, and we hope you'll keep digging into the world of forensic medicine, its impact on patients, on doctors. It's a fascinating field with so much to offer